41 Action News is focused on helping your family go safely back to school. It's part of our Rebound Kansas City initiative. Last week, the University of Kansas Health System reported a pediatric patient died from COVID-19. So far, Children's Mercy has not had any pediatric deaths, but they are seeing some young patients with complications. 41 Action News anchor Caitlin Canute talked to one of their doctors to find out what parents need to watch out for as students head back to school.
As of last week, Children's Mercy was reporting about 250 pediatric patients who had tested positive for COVID-19. It might sound like a lot, but keep in mind they've tested about 8,300. Now, so far, they still have at least one patient still receiving care. We asked doctors, of those patients they're seeing, what are some of the typical symptoms?
In children, one of the common things that we're seeing are cough or shortness of breath, increased work of breathing, just the same as adults. We're seeing fever, we're seeing nausea, vomiting, and diarrhea. In our older children, they may be describing what we're seeing in adults, which is loss of sense of taste or smell.
Doctors say they're also seeing older pediatric patients with sore throats and headaches. Those are symptoms two Shawnee sisters experienced when they battled the coronavirus back in March.
It was kind of just like a cold for me, but my voice was really hoarse and I would say my throat was like pretty dry.
Claire Green felt better in 3 days. Her sister's symptoms lasted a week.
I've never really been sick like that before. Like I was just so tired and then just like a migraine the whole week.
While both girls have recovered, there are rare cases with tragic outcomes. That includes a 9-year-old girl in Florida, the Sunshine State's youngest COVID-19 related death. Her family is now speaking out against sending kids back to school amid rising case numbers.
I don't think it's possible at all. COVID-19 doesn't have an age. Look at Kimmy. It doesn't have an age.
Here in the Metro, Children's Mercy isn't making recommendations on whether students should or shouldn't return to school. They say parents need to decide what's right for their family. However, the hospital system is offering guidance on best practices for schools that do reopen.
They include keeping desks apart, physical barriers. For parents, they include guidance on when and how to keep kids at home. For schools, they include recommendations on how to do routine cleaning as well as cleaning after a child has been sick at school.
So if you do send your child back to school, there are some times you should keep them home. According to new CDC guidelines, if your child starts running a fever of 100.4 degrees or higher, if they're exhibiting signs of illness that could include sore throat, cough, diarrhea, nausea, severe headache or body aches, or if they've had a known exposure to someone with COVID-19. As always, for more information, head to our website, kshb.com. Reporting in front of Children's Mercy, I'm Caitlin Canute, 41 Action News.
Overall, Children's Mercy says the cases they're seeing are mild, with the exception of 8 pediatric patients who developed multi-system inflammatory syndrome, or MIS-C, a condition that appears to occur 3 to 4 weeks after contracting COVID. It can cause inflammation in various parts of the body, including the heart, lungs, and GI tract.